Hello everyone, my name is Nambi Juliet, a midwife of Medisafe Hospital. Today we have come to discuss about UTI in pregnancy. By the end of this session, we'll be knowing what UTI is, the causes of UTI, the signs and symptoms of UTI, how we can prevent UTI in pregnancy, and the effects of UTI to our unborn babies. So we are going to first talk about what UTI is. That is UTI chechi. UTI is a bacterial infection of the urinary system. It affects the bladder and the kidney mostly. So we are going to talk about the causes. Chechiretera UTI in pregnancy. We usually get mothers who are disturbed by UTI when they are pregnant. We are going to see the causes of UTI. There are very many causes, but the most common cause of UTI is E. coli. Kekauka, it is a normal bacteria that we all women have. We have very many different causes of UTI in pregnancy. One of the causes we have having problems in emptying our bladders. When we are pregnant, we become so lazy that when we feel like going for short call, we become lazy on standing up, going to the bathroom. So ogenda okwekanga nga otudde omusolo gukuluma oganya okugenda okufuka nobeera nga we exposinga okufuna UTI. Another cause, these mothers with diabetes, baba ne diabetes, there is always sugar in urine. Sugar causes bacteria to multiply, hence causing UTI. Then we have wiping. Wetuba nga twerongosa nga tugenze manju nga wogenza omaliriza byokola werongosa, abasinga obungi twerongosa tuzza maaso, ate nga tulina kwerongosa tuva maaso nga tudda mabega. So wetwerongosa nga tuva mabega nga tudda maaso, obuwuka obw'emabega waffe tubuteeka wano wantu wali open. So werongosa nga ova mabega nga odda maaso, it exposes us to infections. To increase the pressure of the baby ku bladder, nakyo exposing affe okufuna infections. Obutamalayo treatment, ozze mu ddwaliro tukujanjaba infection, obuliddemu ka enjawulo, either tokomawo oba notamalayo mpekeze tukuwadde. So after like 2 weeks or 1 week, noddamu ofuna infections. So those are some of the causes of infections. So we are going to talk about the signs and symptoms of UTI. Some of the signs or symptoms: pain on urination, osobola ogenda n'owulira ka pain, oba n'olaba omusulo nga gujja kumukumu, oba waakamala okufuka ate n'owulira nga okyayagala kufuka, burning sensation when urinating, lower abdominal pain, fevers, backache, pain when having sex. Those are some of the signs and symptoms of infections of UTI when we are pregnant. How do we prevent these infections when we are pregnant? We can prevent them by early detection and early treatment. Walabayo ka sign, oba olabiyo bubiri, oba kamu, you should run to the hospital and get treatment as soon as possible. And it's always advisable to first do a test before treatment. Sigenda ku pharmacy nogamba njagalayo mpekeza infection, you should always come to the hospital. We do the test, then we treat accordingly. Getting treatment earlier, drinking a lot of water helps to wash away those infections eziba zijjukira zatwagambye za affecting a bladder. So bladder wetujje tukoma okunywa amazzi ne tufuka, obubuka buba bufuluma. Peeing before and after having sex kituyambako okwoza wansi waffe, obubuka nabwo ne bufuluma. Then we can also soak, dry our knickers. We always advise mothers to use cotton knickers. Was sorting at least making a daily routine. So we always advise those mothers to soak their knickers. You soak them in Omo, you dry them. If you can't put them under sunshine, then ziteke ku pant peg yo womala ng'ozigola, ziba zikaze ng'ozigola, obuko obwo nga bufiira ddala. Then avoid putting on tight leggings. Kasera ngobera mu tight knickers, tight leggings, obona tulina obwewala. Avoid douching. Douching kwe kunaaba nga oteekayo engalo kubanga these nails of ours zibeera ne a lot of infections. In treatment, we always advise mothers to come to the facility in case of anything. We're going to talk about the effects of UTI to our unborn babies. If you have persistent UTI when you're pregnant without treatment, exposing unborn babies, they are at risk of low birth weights, preterm labors, okuzaala nga tonnatuuka, okuzaala omwana nga wa kilo ntono. After bamother okuzaala ne tufuna sepsis. So we always advise mothers to come as early as possible for treatment, to always come for antenatal visits and to inquire in case of anything. Ekisembayo twagala kubajjukizaako tulina a number of services. We have family planning, we have immunization, we do antenatals, we help mothers to deliver, postnatal, and in case of any inquiries, we are always available. We work 24/7. We have doctors around, gynae doctors, midwives,